Today in this lecture we will talk about the disorders of urine concentrating abilities. So there are mainly three main disorders of urine concentrating ability. First of all, either there could be high or low ADH, very high ADH antidiuretic hormone or very low antidiuretic hormone. So both of the conditions, very high antidiuretic hormone or syndrome of inappropriate ADH secretion, which leads to a lot of ADH, it leads to massive reabsorption of fluids from the collecting ducts. So it also is a disorder of concentrating ability of the kidney. And if there is very less antidiuretic hormone due to any condition, it will lead to a lot of dilute urine formation. So this is one category of disorders which affect the concentrating ability of the kidneys. Another one is disruption of medullary concentration. The concentration in the renal medulla is very high, and we have discussed this thing that the countercurrent mechanism leads to progressive increase in the concentration of the medulla. Starting from here, it ends up like this one. We have the medulla, which is very concentrated through a mechanism known as countercurrent multiplier mechanism. So if this concentration of renal medulla is lost or it is disrupted, it is also a disorder, and it will lead to inability or impairment of the concentrating ability of the kidney. The kidneys will not be able to concentrate the urine properly. So medullary concentration disruption. And finally, no response to ADH, no response to ADH or inability of the kidney to respond to antidiuretic hormone. Normally, the antidiuretic hormone comes from the posterior pituitary and it acts on the cortical and medullary collecting ducts. So we have discussed that initially there could be a disorder of excessive secretion of antidiuretic hormone, then there could be very less secretion of the antidiuretic hormone or no secretion of the antidiuretic hormone, and finally the antidiuretic hormone may come here but it may not be able to act. So these are the main groups of disorders which lead to inability of the kidneys to properly concentrate urine. In the coming lectures we will discuss each and every of the every disorders in detail. Thanks a lot for watching the video.